Healthcare food service is the foundation that the profession of dietetics was built on, but details of that history are the topic for another class. For more than 100 years, dietitians have been involved in menu planning and improvement that's an important part of patient care. You can see the learning objectives for this short screencast on this slide. This will be the first of several mini lessons to help you write your own menu. I'm sure you remember that the menu is the most important control in the food service system, influencing everything from the foods purchased to the skills of the production staff and the types of equipment necessary to produce and serve each recipe that you might include. But you may not know that healthcare reform in the United States, called Obamacare or the Affordable Care Act, is also having a positive influence on hospital food service. Starting October 2012, Medicare has been able to withhold 1% of regular reimbursements to hospitals that don't meet patient satisfaction standards. The money withheld from some will be redistributed to others that perform exceptionally, as much as 2% by 2016. Hospitals, before this, but still, contract with survey organizations such as Press Ganey to survey their patients after discharge. And to give you an idea of the magnitude for the University of North Carolina hospital system, a 10-hospital healthcare system in North Carolina, that 1% could amount to almost $5 million annually. And Medicare reimbursements represent about 43% of gross hospital revenues and is the largest single payer for hospital care. So without trying to do the math, I'm sure you can appreciate that this has significant cost and revenue implications for hospitals of all sizes. It's not clear how much food influences those survey results since patients aren't asked a specific question about food. Instead, they're asked about the friendliness of the staff, cleanliness of the facility, noise level, and general questions about customer service. Other factors can definitely have an impact. If they have to wait too long to board an elevator while waiting for a test, if they have impolite roommates, or if there's tension among the staff, all of these things can contribute to lower patient satisfaction scores. But more and more, food service managers are citing the Medicare reimbursement as a reason to improve their hospital's food. I can also speak from personal experience that food quality improvement in hospitals has been continuous since the beginning of dietetics as a profession. But that level of financial impact certainly brings it to center stage with chief executives and financial officers. A healthcare menu must change with times and tastes and according to the customers or patients served, and both broad and specific regional preferences and tastes must be considered. In healthcare, we serve mostly elderly patients, but also a significant number of younger patients having babies or receiving treatment for injuries or illnesses, so the menu must include foods that will appeal across the lifespan while also meeting the regulatory requirements and individual nutritional needs presented in both appealing and appetizing ways. When planning for health care, your menu must meet all the nutritional needs of your patients or customers, so nutrition is a significant factor when planning. However, if the food isn't appealing, the patient is unlikely to even try it, let alone eat enough to meet needs. So the next few slides will introduce you to the aesthetic factors that also must be considered. The first is flavor, which is comprised of combinations of sweet, salty, sour, bitter, and savory, or umami. And the right balance of combinations of flavors prompts the patient to try another bite and another and another. Texture is how the food feels in your mouth and might be described by some of the terms that you see on this slide. The macaroni and cheese and the Swedish meatballs you see on the right are both soft foods that together wouldn't provide a contrast in texture. The tabbouleh has both crisp and grainy elements and makes a nice side salad, though probably not with either of the other foods. The image with the tray, which is very typical of hospital food delivery, is to alert you to the important fact that when hot foods are placed under a dome cover, the steam that's released will soften even the best French fries or fried chicken. So not every crisp food belongs under the dome. Consistency also relates to mouthfeel, but specifically the density or the viscosity of the food. The steak in the image is a nice contrast in consistency to the potatoes, either mashed here or roasted here. And finally, colors should complement and contrast with other foods on the plate and on the tray. The color of the plate and the placemat must also be considered. That's why white or off-white china is almost universal in hospital food service. In addition to color, the shape and size of the food is important. Example, peas and rice are both small and round. In the image, the salmon is rectangular, the asparagus is long and tubular, and the potatoes are short and round. Nice contrasts. In the fruit bowl, all pieces of fruit are about the same size, but shapes and consistencies are different. Remembering to include both hot and cold, raw and cooked on a menu also are important menu planning considerations. I hope as we get into the specific details of food and recipe choices that you'll remember that patient satisfaction is important to both the intrinsic value of serving appetizing and flavorful food to patients for whom nutrition is an important element in their medical care, and that beyond meeting nutritional needs, there's several aesthetic factors that make menu writing a challenge. I chose these two images specifically because the top picture lacks variety of texture, consistency, size, and shape, and the bottom picture, well, I don't know exactly what they were thinking. Let's just say they went a little overboard with too much visual stimulation. And I'm hoping that as we proceed through this effort, that you'll be able to find just the right balance of how to bring foods together so that they're both tasty and appetizing to the patients that you're serving.